one of the other questions that we had, so in the scenario where you found your method, you like it, you're happy with it, but all of a sudden you get to the point where I want to start a family. Yeah, and that probably varies based on the device or the method that you're using, but how long after coming off of a birth control method before you can really maybe start to think about having that baby? What do you think? Or trying to have that baby, I should say.
Perfect. Well, in general, with any of the methods, with your next cycle, you would be considered fertile. So you may start to have your period, typically with a pill, you know, depending on when you stop it. If you just had your period, you stop taking your pill, your next cycle, you could have a baby. So within a month. If you had the Nexplanon or the Mirena, something that shut down your period, so you have no idea when you're pulling it out in your cycle, typically you can have bleeding or menses within a week of it coming out. But again, generally up to 4 to 6 weeks, you'll have your cycle and you would be considered fertile. So really not long. It's with your next cycle.
Right.
And then
you can kind of jump.
One of the questions or concerns I had as a consumer was, and I run into this a lot as well with patients, is, what is the long-term effect on my fertility of some of these options? And now that we've had many of these things around quite a bit longer, there's really been no statistically significant increase in issues with infertility, even after term use of either the pills or your IUD. So, yeah. I know that's a huge fear because we women are having careers and putting off family life a little bit longer. And so I think that that's something I run into very frequently as a concern. And it really has statistically studied, not been shown to increase the risk of that. There's other that older women sometimes have issues with infertility. So just the fact that you put it off might cause it, but it's not generally considered related to the birth control.
To the contraceptive. Okay, interesting.